Hello, everyone, and welcome to Maes Medical Minute. I'm Jacob Otto, and we're back again with Dr. Maes. How are you doing today?
I'm doing great. Thanks, Jacob.
Yep. So we wanted to come back and talk about what is happening over at Health Guardian Imaging. Do you want to give us a brief rundown of the machines that are over there?
Yeah, so we really have a lot of great MRI, CT, X-ray, ultrasound, DEXA machines. They're really hospital quality. They're brand new. Everything we have here will do the same diagnostic quality that you can get in a hospital or anything like that, but you don't have to deal with the hassle of going to the hospital and the really multiplicity and cost when you go to the hospital setting. So we have everything here at Health Guardian, and it's really easy to get to, easy to access, and I think it's going to be a tremendous value for all the patients that we serve.
Awesome. So you mentioned diagnostic imaging. Is there anything else the machines are used for, like, or what the difference between diagnostic and screening imaging is?
Sure. So healthcare really, years ago, we were doing our best to kind of, understand what's going on with the patient. So we'd make the diagnosis and, make a treatment plan, and hopefully we got it right. But at this point, our technology has come so far that we're able to make the diagnosis or even see it before it becomes a diagnosable disorder. So, in other words, like when we look at cervical cancer, we were doing the pap smears on women for years because it's catching the cervical cancer before it actually even becomes cancer. And so now we're able to do that with so many different areas in medicine and health where we can catch the abnormality before it even really becomes a true abnormality. So the screening exams that we do offer a tremendous value to the patients. And really, it's the whole goal is to catch the disorder or the disease when it's easiest to treat it before it becomes a more severe process, before it spreads all over the body, before it really starts affecting the patient's health and ability to even overcome that disorder. So we want to, we're looking to cure disease, not just kind of treat it after it happened.
Okay, so you mentioned you had a CT machine, MRI, ultrasound, DEXA. Can you explain to me what kind of screenings we can get with a CT machine?
Yes. So CT machine, you know, one of the limitations with CT in general is the radiation dose. And so that's what we always hear about. We want to use as low a dose as possible. So the things that we're doing with our screening exams are using a very low dose of radiation relative to what you would get with a more diagnostic exam. So for instance, if you go to the hospital and you were in a car accident or something like that, and they do the six, seven, eight CT exams that they would do on you, they're not looking to normally, limit the radiation dose. They limit it to give a good image, but they don't limit it to save radiation for the patient as much. And so you get a really high dose of radiation when you do that. But what we're doing is a lot of screening exams where we limit the radiation dose significantly. And that's because we can adjust the technique on the CT machine so that we're looking specifically for certain things. So, one of the really nice CT exams that we can do right now is the low dose cancer screening for lung cancer. And so for patients that have a history of smoking, a family history of cancer, they may have emphysema, COPD. Those patients are at a higher risk for developing lung cancer. We want to catch it early. So by doing this low dose CT scan, we can catch it when it's a very small nodule, a couple millimeters in size, rather than a couple centimeters in size. It's as big as your fist. And by doing the low dose chest CT, you're getting a fraction of the radiation that you would get with a normal diagnostic CT, but it can be a very good scan to look at your lungs and to see if you have lung cancer. And some of the other CT screening exams we can do with it is like a calcium score for the heart. We could do CT colonography. There's all kinds of things we can do with the CT scanner.
Can you explain a little furthermore what the CT colonography is and what it's used for?
Absolutely. So CT colonography, if I kind of compare it back to the cervical cancer, colon cancer it all starts as a polyp. And so for the majority of colon cancers, they all started as a little tiny polyp in our colon. And so it's the same thing with the cervical cancer. If we screen early and we catch it when it's a small polyp, then we can take it out or prevent it from progressing before it becomes a full-fledged colon cancer. And so that's the value of CT colonography. Um, Patients right now are relying on on a colonoscopy, And that's a lot more invasive exam. And so patients are very reluctant to get it done as a screening test. And really, it's because it's being used as a screening test, but it's really a diagnostic test. And what I mean by the diagnostic test is it's really used to, its use should really be for confirming the diagnosis and removing the polyp. It's not really made to screen for polyps. And that's really where CT colonography comes into place. So with a CT colonography, it's a very easy exam for patients to do. The whole exam takes a matter of minutes. You take a little bit of a bowel prep just like you do with a colonoscopy, but you basically have a little bit of air inflated into your rectum, and we're able to do a CAT scan of your entire abdomen. And then we go back and we reconstruct the images. So it looks honestly just like the colonoscopy images, but it's all done with a CT. So we can look through the colon, virtually kind of fly through the colon. So that way you don't have to have the camera that goes all the way up around and through your colon. We just do one CT scan and then we reconstruct it with the computer. And so we can look at all the same things. We can tag all the different polyps that we see. If there's a polyp, we can see it, we can measure it, and we can follow it up. If it looks, obviously if it looks like colon cancer or if it looks more alarming, that's the patient that should go on and get the colonoscopy. We really shouldn't be doing the colonoscopy on everybody. And the other problem with doing colonoscopy as a screening exam is most people are getting it done every 10 years. And the reality is colon cancer, it's slow growing, but it doesn't grow quite that slow. And so there's certain patients that have a colonoscopy, they may develop a polyp, and by the time they follow up in 10 years, it's a full-blown cancer. And maybe it's been diagnosed another way along the way, but by that time, the horse has left the barn, and there's not a lot we can do about it. But with doing the CT colonography, because we can do that about every 3 years, and again, we use a lower radiation dose to make sure that it's safe for the patient. We can do that every 3 years. So if there's a polyp, we're going to catch it soon, within a couple of years. So it doesn't have a chance to grow from polyp size to colon cancer. Whereas with the colonoscopy, 10 years, it's going to grow into colon cancer. And so there's a lot of patients that come in and they're diagnosing colon cancer on a colonoscopy. And we should never be diagnosing cancer on a colonoscopy. We should have seen it as a polyp and treated it much sooner.
Oh, so sounds like we're going to, using a colonoscopy or colonography, you can maybe get 3 or 4 chances at catching it versus 1 or 2 before it becomes such a bad ordeal.
Yeah, exactly.
Outside of that, you said you had a DEXA machine. What is that used for? And kind of explain to us what it is even.
Sure. DEXA machines typically are something we think of as in the elderly. So we're looking at the bone density. And that's the context we've typically heard of a DEXA scan being used. So it's looking at bone density, which assesses your fracture risk as we age. And we certainly can do that. And that's one of the good jobs that the DEXA machine does. But our DEXA machine also has the ability to do much more than that. So we check the bone density, but we can also evaluate muscle mass and we can evaluate fat composition. And so when you have a patient that's either trying to lose weight for obesity or trying to gain weight, it's really important to know where that weight is coming from. And so if you're losing weight, especially, you want to make sure that you're losing fat and not muscle mass. And so by doing the DEXA, we can follow up with the patient on every 3 months, every 6 months. We can check and see exactly where the fat composition is being lost from, because it will tell you where in your body exactly. It does a map and it'll show you exactly where that fat is being lost. And we know that the fat that's really harmful for patients is what's called the visceral fat. And so the visceral fat is the fat we have around our organs inside our abdomen. And so that's the fat that's really high risk for developing heart disease. So patients that carry a lot of fat in their shoulders or their back or their arms or legs, that's not as risky for heart disease, but it's the fat that's actually in the belly. So that's another advantage of the DEXA scan, is it can actually quantify exactly how much fat is in your abdomen, so your visceral fat, and then we can use that to follow the patient. So as they're losing weight, we want them to lose weight, but we also want them to reduce the amount of visceral fat that they have, because that's what really affects the risk for heart disease. And likewise, if someone is a bodybuilder and they're trying to, increase their muscle mass, they're consuming large amounts of protein and doing different things with their workouts. we want to see where you're gaining the muscle at and muscle mass. So if you're gaining weight and you gain 10 pounds of weight, but we do the DEXA scan and 9 of it was fat, well, you're probably not accomplishing what you want to do. So you need to alter your diet a little bit more so you can see exactly how much muscle compared to fat that you're gaining on the DEXA scan. So it's a very helpful tool.
Yeah, as somebody who worked out for years and couldn't gain any weight, I'm sure that's probably helpful to know what you should be eating or how to change your diet.
Absolutely, yeah.
Outside of that, another big modality of imaging used is ultrasound, but everybody kind of views that as pregnancy and looking at the baby inside the uterus. What else can an ultrasound be used for?
Yeah, ultrasound, it has so much more value than just looking at the baby. I mean, you're right. That is what everybody thinks about first when they think of ultrasound. But ultrasound uses a sound wave, so there's no radiation involved. And it's really good at looking at soft tissues, and it's good at looking at fluids. And so it can look at your organs in your abdomen, your liver, your spleen, your pancreas, your kidneys. It's really good for looking at that stuff. But it's also good for looking at fluid. So when I say the fluid, it's the fluid in the vessels. And so we're able to look at all of the arteries and veins to some extent within your body, so we can, look for abnormalities there. For screening purposes, we can do a screening ultrasound of your abdominal aorta, and that's the one that a lot of people, especially as they age, they're at risk of developing an aneurysm in the aorta. And if it ruptures, certainly it's very low chances of surviving it. But if we can screen for it with an ultrasound, and we can catch it before it becomes overly large, we can treat it ahead of time before it even becomes a problem. So the ultrasound machine is really good at screening for that. Likewise, we can screen all of the blood vessels that go in your neck that, increases your chance of getting a stroke. So if you have a narrowing in the arteries that are supplying the blood in our carotid arteries that are going up to our neck, the ultrasound machine can detect that well before, patients are even experiencing stroke symptoms. And so that's a good thing to know. And we talk about, I think everybody knows about heart attacks. That's decreased blood flow to the heart. We know about a stroke, that's decreased blood flow to their brain. But one thing we don't think about is a lot of patients have pain in their legs and their back, and they assume that all of the pain in their legs is related to a back problem. And that's not always the case. A lot of times it's narrowing in the arteries that supply the blood to our legs. And so because you can't get enough blood flow to your legs, it causes pain. And so a lot of people that are experiencing leg pain, it may not necessarily be from their back. It could be from their back, but we also need to make sure that we're looking at the arteries that supply the blood flow to the legs. And that's where the ultrasound really comes into play and shines very well for us.
Awesome. I was looking at the website and I noticed there was like a vascular screening. Is that capable of telling the blood flow in the extremities and all of those types of things?
Yeah, and that's one of the real benefits of it. So we've kind of combined all these things together so we can screen the aorta, we can screen the carotids all at the same time. We can look at the arteries in the legs. And then we can also look at the thoracic aorta. So when you hear about people that have what's called an aortic dissection, that's typically an abnormality that develops in the aorta as it comes out of the heart and goes down towards the abdomen. So there's different segments of the aorta that we can look at and screen for the disease that occurs in those areas.
Sounds like you could screen for almost all of these sudden death symptoms. Is that fairly?
Yeah, that's a very fair statement to say. So, there's certain people that are going to develop something quickly, an aneurysm in the brain, for instance, and it's going to develop quickly and it's going to rupture, and there's not a whole lot anybody can do about that. But the majority of aneurysms in the brain develop slowly. They're there for years, and people just don't know they have them. And so if we can screen for the aneurysm, we can go in and treat it when they're asymptomatic before they have any problems, and then essentially cure the disease before it even has a chance to be symptomatic.
That's awesome. So the last one, I think it's the big one. Everybody hears about it with athletes, and it's like a glorified screening, or imaging. The MRI. What can be done with the MRI screening wise? Yeah,
MRI has so many utilities that we can do with it. It's one of those studies that it's good at looking at muscle. It's good at looking at bone. So it really is a weekend warrior that can kind of take a look at everything for everybody. About the only thing the MRI is not great at is looking at the lungs, and so that's why we really rely heavily on the CT for the lungs. But the MRI, we can do a full body MRI, and so that's where we're imaging from basically the head through the mid thighs or to the knees, And so we're able to look at everything in one kind of big picture. And we're screening. So we're not looking at things like, oh, I hurt my shoulder last week and I want to see if my rotator cuff is torn or not. We're looking at things like we're looking for cancer, for masses, for large problems. So we're screening all the bones, all the soft tissues, all your organs. We're able to look at all of that in one image on this full body MRI. The MRI machine has so many different utilities. That's great. It's really good at looking at, I was talking about the aneurysm in your brain. There's an MRI or an MRA that we can do of the circle of Willis, and the circle of Willis is what we call the blood flow that goes to the brain directly. So I talked about the blood comes up in the neck through the carotid arteries, and then it supplies the brain through what's called the circle of Willis. And the circle of Willis is where those small aneurysms actually develop. And the best way to detect those is to do an MRA. And we can see them when they're 2 or 3 millimeters in size, and treat them then rather than waiting till it gets to be 8 or 10 millimeters in size and is a significant risk of rupture. So MRI is a tool that can do that. It can screen all your abdominal organs, liver. A lot of people, if they have liver cancer, it shows up. If they have metastatic disease, it shows up. But even if they have something that's like cysts in their kidneys, we can see those, and then we can determine if those are cysts that are normal or normal-ish. In other words, they're part of the normal process of aging, and they go away and come and go, or they're a cyst that can potentially progress to malignancy or cancer. And so those are some of the advantages of being able to do that full body MRI, is we can really get a detailed picture of what everything is doing inside your body, under the skin. All the stuff that we can't see on the skin surface, that's what we're really looking for in screening.
So I just did a full body MRI yesterday, actually, and the only thing I could think of the whole time I was in there was my mom died, and they diagnosed her with like 3 different types of cancers. What are they going to find in me? Mm-hmm. Is that a good thing to do if you have a family history of cancer or anything like that?
Yeah, and honestly, I know we're all afraid of what the doctor's going to find, but we can't change history. We can't change the future. We can alter the future a little bit, but if you were predetermined to develop cancer, you're going to develop cancer. We can't stop the cancer from occurring in your body, but we can detect it when it's small. And so if you develop kidney cancer, for instance, or colon cancer, me personally, I would rather know about it as early on as possible when I can treat it and do something where I have a normal life length, rather than waiting until I'm in my 60s and the cancer's gone everywhere. And by the time I find out, maybe I have 6 months or a year to live. And it's not a happy 6 months or a year that you're living through. So I know we're afraid to go to the doctor because the doctor's going to give you, the bad news. And that's the challenge in healthcare and medicine in general. Unfortunately, we have to deliver that bad news. But I would rather, get that news to the patient early when it's treatable and we can do something about it, because we can't make you not get colon cancer or lung cancer, but we can find it when it's really small and it's treatable. So, for your full body MRI, hopefully they didn't find anything, but if they did, let's find it now where we can do something about it rather than waiting. If your mom died from cancer, obviously there was a point in that progression that hopefully we could have probably found it sooner and treated her, and maybe she wouldn't have died as early as she did.
Maybe it wouldn't have been the death sentence it was if it was caught earlier.
Absolutely, yeah.
What other screenings are available at Health Guardian? Is there anything we didn't talk about that you think is important?
Yeah, so we do all the imaging screening tests, but we also have some lab screening tests that are really important. We can do the typical things like checking your cholesterol, but we can assess your risk for developing diabetes. We can see where you're at in the journey, especially as patients are losing weight. There's some really important things we can screen for. We can screen for hormone levels in men and women as we age, and we find that our testosterone in men or our hormone levels in women are really kind of tapering off. We can replace those hormones by checking the labs and really just kind of changing the way people are able to function in their later years of life. We don't have to kind of fall off this cliff. We can kind of decline gradually. And I think that's what we're seeing right now is a lot of people, they're doing okay, and then they just kind of fall off this cliff and they age rapidly. Right. And a lot of that can be prevented.
Awesome. Beyond that, there is one screening you guys offer that isn't for necessarily you're not healthy, but you're too active. What is that all about for the athletes?
Okay. Yeah. So thanks for the hint there. Read my mind. Yeah, no, I think that is very important to talk about. There's a condition that we see in a lot of young athletes where you hear about an athlete that just kind of drops over dead. They're in the peak shape of their life, and they're working out all the time. It usually happens in athletes when they're in their late teens or early 20s, but it can happen really at any point in their life, and that's a disorder of your heart. So if we look at the heart muscle itself, there's a wall between the two sides of the heart, and in certain population that wall overgrows, and so as it thickens, it eventually starts blocking the flow of the blood going out of the heart. And that's what happened to my really good friend Robbie Anders. Is he had this heart defect where his heart muscle, separating the two sides of the heart, was actually growing too thick, and so the better he got in shape, the thicker the wall got. And so for Rob, he was 43 years old, perfect shape, and he drops over dead. And that's horrible. That should never happen. But there's a screening exam we can easily do of the heart with the ultrasound machine. So it's a limited echocardiogram, but we can look at the thickness of that wall in the heart and identify the people that have this disorder early. It's a completely treatable disorder with medication, and if the medication doesn't slow it down, there's other things that they can do with procedures, and also even if they have to, they can even put in a pacemaker. So that way, if you have an abnormality, it can identify it and it can shock the heart if it needs to. And so all of these things are something that could have been identified early, treated early, and within the young athletes, we offer that free for all of the athletes in the Missouri area. So anybody that comes to Health Guardian, we will do the screening ultrasound of the athlete's heart for free. We're not going to charge anything. All I ask is bring a parent in with you. That way, as we give the results, you have a parent with you so you can receive the results, and we can push you forward with the next steps that you need to see a cardiologist for. All of that is going to be offered totally free. If you want to donate to the Robbie Anders Foundation, that's a nonprofit that's set up to offer scholarships and things like that for kids. Robbie Anders was in the community here locally. He taught basketball. He played professional basketball, and he also played college basketball at Missouri State here locally. And so that's something we want to make sure that we're doing, is just offering that to the community so that doesn't happen to anybody else. That really should never happen anymore.
Yeah, so young athletes don't need to be dropping over dead on the field or on a basketball court. There's a way we can screen for it, save those lives, which I am truly grateful for. I have a young athlete as well, so knowing that you can come in here and get that screening is awesome.
Yes.
Where can people find you?
Okay, so we're located on Bradford Parkway. We are a couple blocks away from Cox Hospital off of the Medical Mile from National. But if you come down towards Bradford Parkway, we have a McAllister's on the corner. A lot of people know that in town. But we have a large building, a large sign. You can see us pretty easily. We have Health Guardian Imaging as the imaging center, and right next door to us is Health Hub Clinic, a partner that we work with to provide all this great medical care. And that brings up one of the important things with screening in general is the screening exams that we're doing. You don't necessarily need a doctor's order to obtain the screening exam. You're essentially self-referring yourself for screening because you know that you want to be proactive about your health. So in doing that, we're able to do it without the doctor's order because we have the clinic set up next door to us, that if we do find an abnormality, we can refer you directly to them to give you the next steps in the clinical care. That's a really important thing to do, or to keep in mind when you're getting screening exams done in general. You have to have a place and a network set up so that you can follow up these patients. We can't just give you abnormal results and then just send you out and you fend on your own. We want to make sure that we set up an environment where everybody gets diagnosed at an early time, an early stage in the disease, and then have a place that we can refer you to. If we do find that abnormality, we refer you there to the clinic, and the clinicians there are really good about identifying what's abnormal, what's not normal, and they can refer you on to the next step and getting your treatment taken care of.
Awesome. So if you have a doctor's order, that's considered diagnostic imaging. Patient-initiated screenings are without doctor's orders, and those are no symptoms, family history. I just want to make sure I'm okay.
Yeah, that's an important thing with a diagnostic exam is when there's an abnormality in the patient. So the patient is already symptomatic, whether they have a cough, they have a fever, they've had weight loss, they're having pain somewhere. When you go see your clinician about those things, they're going to order a diagnostic exam, and that's the exam that comes with the doctor's order. But if you're really just doing screening exams, that's for the patient that has no symptoms, but they say, hey, my mom died of cancer. I think I should get a screening exam. And so that's perfectly reasonable to self-refer yourself for a screening exam. It's a wellness longevity process. We're trying to screen and find things before they become a problem for you.
So if you got a doctor's order or just want a screening exam, both can be done at Health Guardian Imaging at 1505 East Bradford Parkway in Springfield, Missouri. You can locate them on the internet at healthguardianimaging.com. I will put a link to that in the show notes, or you can Google them and it'll all pop up there. If you have any questions, you can visit askdrmaes.com, AskDrmaes.com, and ask questions there, as well as subscribe to the blogs he's putting out as well to answer a bunch of questions for patients, and even radiologists, if they have questions, are available there too. Anything else you want to talk about?
No, I just, I appreciate the value and importance of screening. And, we really are here trying to change the way healthcare is being practiced currently. We've had such a reactionary approach to medicine where patients have the diagnosis and then we're trying to treat it. And we really want to change that system. We want to find the diagnosis before it becomes a problem. And so we are changing the way healthcare is practiced. And I think this is a more proactive way to do it. It's the way I would prefer to do it. If I were going to have any kind of cancer or any kind of disease develop in my life, I would like to know about it as soon as possible so I have the best chance of beating it.
Awesome. Well, I appreciate your time and I appreciate the information. I hope you have a great day.
Thanks, Jacob.